much, Sue. This evening, then, I want to have a kind of dive into some research that I did before the pandemic, and then we decided to repeat it during the pandemic. Now, if you're listening tonight to this program, I'm sure the staffing and burnout crisis in midwifery and similar professions has not passed you by. And listening to those stories over the past few years was what really kind of inspired me to start thinking about this in terms of lactation and breastfeeding support. It was ignited by that, further kind of flamed by my own experiences in working around breastfeeding support and working in research and academia in this subject area. It also came out of the book that I wrote a few years ago, Why Breastfeeding, Grief and Trauma Matter, that looked at women's experiences when they weren't able to breastfeed for as long as they wanted to. And what was really clear from the research around that book was the impact of trying to work in a system that just doesn't support or value breastfeeding. So thinking about the broader system of necessary funding and sufficient resources and all those social influences and attitudes towards breastfeeding. And to me, it was really clear that so many women were struggling within that system to feed their baby, but also those who were trying to support them were being affected by the same influences as well. And it became even more complex because often the reason why a lot of people end up in breastfeeding support and lactation support is because of their own difficult experiences in the first place. So they have such a tough time that they go into breastfeeding support absolutely determined to try and make things better for the next generation of women. And of course, they come up across the same problems all over again. And as I'm going to talk about in more depth in a bit, that kind of hurt and grief and loss that they experience gets even more exacerbated by seeing it continue. So I really wanted to try and explore this in those working in lactation support. And we chose the phrase lactation support from the book because it was really thinking about the lactation support role, trying to make it slightly different to the experience of breastfeeding. So we're really thinking about those who are working as lactation consultants, breastfeeding counsellors, breastfeeding peer supporters, midwives and health visitors who are supporting breastfeeding and families, and those working in specialist infant feeding roles. So the research that I did for this project was, well, it ended up being in two stages. I never planned to have this in two stages. We did the first lot of research in 2019, really exploring how those working in lactation support felt about their role. I never expected to have to or be able to repeat it again during a global pandemic at that point, but that was the way things unfolded. So back in 2019, 727 people who were working in lactation support took part in this. So it was a global study. The majority were from the UK, but there were participants from the US, from Canada, from across Europe, a lot from Southeast Asia, from Australia, New Zealand. It was a really good global mix. In lockdown then, I decided to repeat a smaller version of the study to measure how things may have changed or been affected by the pandemic. And during that first lockdown, so during about the May-June period back in 2020, I repeated the study and 520 people took part. And similarly, they were from all around the world. And what I was measuring in that study was trying to understand how those working in these professional and volunteer roles were feeling about that. So it was very much taking a snapshot of the motivators for working in a role and the positive outcomes for working in that role, but then thinking about some of the stresses and challenges. So alongside the experience questions, I took measures of whether they were feeling burnt out and exhausted in their role or not. But then some of the things that might go alongside that. So I measured empathy, because we know that that is such a big part of any supporting role in healthcare. But what can also end up being tied to higher levels of burnout because we just care so much. And it's an experience that you probably see in your colleagues and friends working in any area of healthcare all the time. I also measured imposter syndrome just because it was one of those things that I know we as women are just so, we have such a tendency sometimes, even when we're in really experienced positions, to still feel that we're just, not doing well enough, and that any minute now a grown-up is going to come along and catch us out and tell us that we shouldn't be doing this. So again, this really featured as quite key within the findings. And then, because I really did not want this to be it's all negative, it's all going to end in disaster kind of research project, I asked questions around, well, okay, so even if this is really stressful, what keeps you going? And that element of the research is just so lovely to read. It's just so affirming, and I'll come back to it now. And again, then, well, what do we need to change? And basically, we need to overthrow the entire system and start again, if that's all right, if anyone can get around to doing that. So just starting off then, I was just really struck within the responses from across those two stages of the survey, just how much those working in these lactation support positions got so much joy from the role. So there was so much personal reward in terms of being able to support a new mother, being able to support a family, to see the partner click and understand why breastfeeding was so important, or to see a grandmother's kind of whole way of thinking about how babies should be fed changing. And just some of the quotes here: breastfeeding support is one of the hardest jobs I've ever done, but the most rewarding. And I love what I do and being able to give back and support families. I can't imagine me without it. And it's an absolute privilege to be able to serve families in this role. So even though, as you'll see, participants talked about a lot of stresses and barriers in the role, the real heart of the role of working with families and working one-to-one with women and their babies and their wider family was just so important. It was kept them buoyed as such. It just kept them going, even with the paperwork, even with the bureaucracy, even with the colleague who worked in a different area who really did not understand supporting breastfeeding. However, quite a lot of people in both surveys talked about this really mixed experience. And I just love this quote from this infant feeding lead. So some days it feels like a roller coaster. You're pulling your hair out because you can't organise a room for the peer supporters to run a group, or have heard that yet another mother has been given incorrect advice by another professional. But then you get a thank you card from a grateful family, or see the difference in someone's face when they finally latch their baby on pain-free. Some days when my husband asks me, how was work? I genuinely do not know what to say or where to begin. And even though I'm talking, about working to support breastfeeding here, I think this could be applicable to so many roles and positions across midwifery, across health visiting, across healthcare in general. It's that continual high and low. Days are never boring, but also it's thinking about you within this system and how it's impacting on you. So to go to a slightly more negative outcome from this survey, one of the things that I did within it was measure symptoms of burnout. So the questionnaire that I used had 3 different scales to it. It looks at personal burnout in terms of how you're feeling in terms of yourself. So whether you're feeling emotionally exhausted, physically tired, and then whether you're feeling burnt out and exhausted in terms of your work tasks and your role. So your very kind of specific tasks. And as you can see, quite a high proportion of those in the survey were experiencing these emotions and feelings really, really frequently. There was really quite a high level of emotional and work-related burnout, and this only increased during the pandemic. And I want to really kind of get into that when I can really look at this data. As you would expect, it went up in the pandemic. We all know we were more burnt out, we were all more stressed, there were more demands on those working to support families in every way. And of course, it was further exacerbated by the experience of just living through a pandemic. But these statistics are really quite high, and they're really quite worrying in terms of the pressure on those working in lactation support roles, because clearly a lot of people who were taking part in this research were feeling exhausted and stressed, and like a lot of the roles that they were doing day to day and the tasks they were doing day to day were leaving them feeling really frustrated and just really burnt out because of the work. And we know this is a worry because we know that when people start getting burnt out, not only is it awful for their mental health, but they can end up going off sick. They can end up with all sorts of stress-related health issues. They can end up with what is known as compassion fatigue, where they almost run out of care, that, you know, the compassion that they feel for the families goes. We also know people end up leaving and going to a different career altogether, and we lose good people due to the stresses of the job. Now, that was the one side of it. But when I came to the third scale, which specifically looked at the experience of working with families, everything turned around. So those statistics on the previous screen, you're looking at 50, 60, 70% of lactation supporters with symptoms of burnout in related to their personal exhaustion and their work task related exhaustion. When you turn it around and you look at families, it's really, really low. It's not the core role of supporting families and engaging with families and working to support breastfeeding and mothers and having that one-to-one care that is bringing people down at all. There are a very small percentage here. So 5% finding it hard to work with families, finding it frustrating, feeling drained of energy by working with families. And this is very, very similar data to other research from around the world that has looked at burnout in midwives and burnout in nurses, in that the levels of personal and work task related burnout are high. But when it comes to the core role of what you came into the professional volunteer post to do in the first place, when it comes to that compassionate role, that supporting role, then it eases. It's not that at all. And it's ironic in a way, well, fully ironic really, that the reason people come is not stressing them, is not burning them out. It's all the other stuff that goes alongside it. So the barriers and the paperwork and feeling the bureaucracy and all of that. So in terms of what is so stressful about working in lactation support, there is so much, and I could go on all evening and you will probably cut me off. I think I could go on to at least the next day in talking about this. So I'm just going to pull out a few of the quotes and a few of the issues. It is so reflective of the situation that women are facing when they're trying to breastfeed. So whenever I talk about, the barriers to breastfeeding, I'm always talking about a lack of government investment. So don't have the funding in place to give every woman who needs it support. We don't have sufficient funding into midwifery and health visiting and lactation specialist roles. And that affects women's ability to get the support they need to continue, but it also adds to the stress and the feelings of burnout of those trying to work within the profession and volunteer within those communities when there isn't enough investment and support coming in. So just here, one of the lactation consultants said, it's demoralizing when politicians sitting in their offices and who never see families reduce budgets or fail to support policy. They don't see the fallout in our communities, yet hold all the power. And it's the day-to-day experience of feeling that you have to protect women and you have to create a safe space for them when that society that you're working in isn't valuing it and you aren't getting the support that you need. And closely linked to that is the lack of societal understanding about breastfeeding. So all the culture around not understanding normal baby behaviour, thinking everything is the fault of breastfeeding or thinking everything is solved with a bottle of formula. And a lot of peer supporters in particular in the study really talked about all the time that was spent trying to talk about and evidence and push back against incorrect information that was coming in. So trying to explain that the formula adverts weren't telling the truth, and that the family member who said that if you just put the baby on formula that they're going to sleep. So it felt like a mother came into breastfeeding peer support group and needed support with her latch, but actually you had to unpick a load of other things before you could even begin to support the latch. And the feeling that you're continually working against that system that's kind of coming down against you. The other issue, a big issue, is the criticism and the conflict, especially on social media. So a lot of people who took part in both surveys were saying it was so difficult to be attacked online. Trolls coming along and accusing them of things that weren't true, of seeing countless news articles and headlines where researchers got misconstrued, or social media at the moment where formula companies are deliberately working with influencers on Instagram to try and convince everybody that dads need to give a bottle in order to ever be able to bond with their baby. That's my bugbear at the moment. There's a whole big campaign going on there. And it was just feeling that there was so much pushback coming. And the other element was when working alongside colleagues who did not understand. So they weren't in infant feeding roles, or they're in different professional roles, and they didn't see the importance of breastfeeding to women, and they didn't believe that breastfeeding was important, and that they deliberately worked to undermine what you were doing, or override instructions that you give, and you end up picking up the pieces of when you come back in the next morning, and somebody has given complete different instructions on how that baby should be fed, and you know that it's really damaged a mother's breastfeeding experience. The other element is just the Groundhog Day of it, of seeing the same misinformation on social media and the same criticisms coming up on social media all the time, and continually feeling that you're pushing back against it. And every time you solve one area and give some correct information and support, something else comes back up again. One of the respondents said to me, I said to them, what would you change in lactation support? I'm sorry, I can't give you a lottery win to fund this. And they'd written, they said, well, you might not be able to give us a lottery win, but can we just have the same money and investment that the formula industry does? Followed by, oh yeah, there's more chance of winning the lottery, isn't there? So it's kind of just thinking about the continual things kind of grinding people down, when at the heart of it, and what you're trying to protect and create that safe space for the families who you love working with, and you get so much personal reward and satisfaction, but it's like you're having to hold up a huge umbrella over them and try and protect them from these industry messaging and people who don't understand breastfeeding and a lack of support, whilst also sort of battling that system yourself. One of the biggest things for me in this survey was the sheer amount of empathy that those who are working and volunteering in lactation support have. So I took a measure of how empathetic respondents were in the survey. So it was really looking at the tendency to, take on other people's emotions and really feel how they're feeling, and your ability to understand the emotions and the experiences of those around you. As you can imagine, being really, really empathetic is a bit of a double-edged sword when it comes to working in lactation support or midwifery or health visiting or any caring profession, because a tendency to be really high in empathy means that you're really, really good at your job most of the time, because you understand people's experiences and you understand what they're going through, and you can reflect back to them and really help them process how they're feeling. The kind of other side of that is that you often carry the weight of the world on your shoulders because you absorb other people's emotions. And I remember one woman in the survey saying something like she carried the weight of all the women that she was supporting. and that she felt like she couldn't put it down, that she was trying to carry all their stresses and all their grief and all their loss for them, and that was impacting on her. So when I measured empathy in the survey, I'd used a measure which had a cut-off average point, and absolutely everybody scored above average. There wasn't a single respondent who had lower than average empathy. And actually a big chunk of them were really, really high. And of course, it's those skills that make all the difference. And, you know, just the quotes here, my heart has broken alongside so many mothers over the years who haven't been able to breastfeed, and really feeling that experience. And I have to say, it's one of the biggest things that overwhelms me in working in infant feeding research, that you hear so many distressing stories. So when I look at things like breastfeeding grief and why women haven't been able to breastfeed, just the depth of the emotion in that, and reading those stories day after day and after day is really overwhelming. I mean, it's such a privilege to hear, and I'm so grateful to have that data and be able to talk about it, but also I can understand the emotional weight of it. And I say in the book, and I've said a few times to people, you know, I always wanted to be a clinical psychologist. I wanted to work and support people in mental health, but I decided that would be too overwhelming with me due to quite a high tendency to have a lot of empathy. So I thought I'd be a researcher instead, and go into breastfeeding research, where it was probably more distressing than any other area. But it's this tendency, and the reason why is because so many people end up in lactation support because of their own distressing feeding experiences. So there's a bit of a myth amongst some people on social media, going back to the social media conflict slide, that people end up in breastfeeding support because they've had really easy experiences and they just want everybody to act like them. So we're all going to go and skip through a field with daisies feeding our babies. It's going to be that easy. But that's usually completely as far from the truth as you can get. I'm sure there are people who have had really straightforward experiences, but most people end up working and volunteering in this field because they've realized that there is a big support gap, or they've had their own difficulties, or they've just really been so distressed by their own experience of having to stop before they're ready, or bringing in and using formula before they're ready, that they just want to try and stop anybody else from feeling that way. The other element of this is the very high tendency of many in the survey to score highly on imposter syndrome. So this concept of never feeling good enough and always doubting yourself. And so many people within the survey said that they spent a lot of time at the end of the day playing over and over in their heads all the conversations that they'd had, thinking, did I do enough? Did I say the right thing? Who am I to be working within this role? It was so common. And of course, you know, the experience in itself of doubting yourself probably means you're absolutely brilliant for the role, because you're questioning yourself and it means so much to you. But, you know, just one of the peer supporters here, where it feels like what I say carries too much weight. What if I get it wrong? So you're really worried that there's not enough support for mothers. You really care about them. You really care about breastfeeding, and then you're worried about it yourself. So no wonder people are feeling overwhelmed. However, saying all of that, and I'm just keeping an eye on the time before I do go on all evening, thinking about one of the big things I asked them was, why do you stay in your role? Not as in why on earth you stay, but why do you stay? What are the good parts about this? And this chapter in the book is just such a pleasure to read. It is just so lovely, kind of spending that time reflecting on just how wonderful a role like this can be, even if there's a lack of support for it and a lack of understanding of it, and fights are breaking out on social media. Actually, when you come back to it and think about that core role of supporting families. And this one at the top here, I've served women for whom breastfeeding is an integral part of their recovery, including those who've experienced sexual abuse and violence. Simply, I could never give up on them. It would destroy them to be failed by me too. Others talked about spending time on neonatal units, on paediatric units where mothers were fighting and fighting to get their baby fed, and a baby was fighting for their life, or an older child was really unwell. And they were just talking about the sheer privilege and responsibility of being able to be there and make that difference. And just related to these here, nothing will ever be better than the feeling you get when you fix someone's pain or help them feel less anxious. And the pride as well. And this is something that, when I was reading more broadly around this area, really comes out in midwifery and nursing too, you know, that real pride of being in your role. So I love being able to call myself an IBCLC and being able to call this group of professionals from around the world my colleagues. And what was really clear within the data was that although conflict on social media and with some colleagues who didn't understand breastfeeding was common, there was just a real connection within the field. So virtually everybody in the survey said they had that one person, that one really close colleague and peer who you could offload to, who you could share everything with, who kept you going and kept you buoyed up. And you just knew you would not be in your position now if you didn't have their friendship and their support. So it's just thinking about that connection as well. In terms of protecting ourselves, one of the questions I asked, and it feels like cheating a little bit, but I asked everybody, well, what can we actually do? What can we actually do to support our own mental health here and make sure that we don't burn out? I think my very favourite quote referred to, we all need to spend more time in a hot tub with a gin. It seemed to be, you know, that's the title of a book in itself. But just some of the things in place. So realise, and some of these, the peer supporters in particular, were so eloquent in terms of just getting us to step back and think about how we talk to ourselves and don't criticize ourselves and don't put the pressure on ourselves. And this quote here, so realize we can only do so much and we aren't responsible for all of infant feeding. If we make a difference to one mum, then we're winning. So it's about reframing things. Boundaries here, boundaries are extremely important. It's vital to me that I have a life outside of breastfeeding and live it. And so many tips around, you know, having separate phones, putting strict limits on your social media, trying to get around that if you can, and spending that time looking after yourself. And one of the reasons that we called it the compassion code when were writing the book was that compassion is at the heart of what everybody working and volunteering in lactation support does. Is compassion for the mothers, for the babies, for the families, for breastfeeding in general. But what many of us need to take a lesson in our own compassion and treat ourselves that way. And quite a few of the respondents in the survey just simply said we need to treat ourselves with the same kindness that we treat the mothers that we care for. And I spend a lot of time talking to mothers who haven't been able to breastfeed and saying, look, you didn't fail, it was the system that failed you. And if you're working in lactation support and you're thinking you're failing, it's reminding to apply the same messages that we say to parents all the time. You know, you did not fail, you were failed by the system, you're fighting these barriers around you. And coming back here just to the importance of those good working relationships with other breastfeeding supporters, we're stronger together. And it's really focusing on the good people. There might be so many people out there not understanding and criticizing and sending you personal messages, accusing you of things and being nasty and trolling, but actually think of those good people around you, those connections, that one person, listen to them. It's Professor Brene Brown, who I always bring up. I've got all her books. If you haven't read those, you need to go and read those around. She's got a little exercise where she talks about having a little piece of paper in her wallet with the names of the 5 top people she actually cares about. And whenever she's criticized or feels low about something, she thinks of those 5 names and thinks, well, what would these 5 people who are really important to me think? Would they be criticizing me? Do people who are not on this piece of paper actually really matter? It's these people I should be listening to. So I unfortunately cannot go out, gone all night, but just to talk a little bit about the book, it is out next week. I really wanted to draw attention to the cover because it is by the brilliant artist Leanne Pierce, who has been designing covers for us, and just to make sure that we all shout her name as well. So if you would like to get a copy, it's available on Kindle for pre-order. It will be on Amazon next week, or a signed copy from me from my website to add to your collection. So thank you.
Thank you so much, Amy.
Wherever I am.
Yes, Amy. No, I'm kind of transfixed, really. Partly by the artwork, and I had a look at this, and this is on the resource list as well, and a very, very reasonable price. And Kindle is very handy if you're going on holiday and you're just trying to pack up a few books to take with you. This takes no weight.
It's a little book as well. So
yes.
It fits in your handbag.
But
or your laptop bag.
It's even more tempting to have a signed copy. That's even more delicious. and that's quite accessible, isn't it? That's fabulous. I mean, I was very interested. I mean, we've got some questions coming in, but I've been very interested on the impact of social media, because that's something that's a fairly kind of recent activity, and it's quite depressing to think that that's impacting on people who are trying to do their job and support women and families, and the babies, obviously with their feeding, are having that experience as well.
Absolutely. I mean, social media is so good for giving breastfeeding support, and I think everybody would agree with that. It's a brilliant way of reaching people. But I think the level of criticism and misunderstanding and nastiness that goes on is something that we need to speak out about more, because a lot of people in the research talked about just how much it hurt them, that they say something on social media and they're not meaning anything nasty by it at all, but somebody takes the wrong impression of it, or they accuse them of thinking something that they don't think, and all hell breaks loose, and people can be really, really nasty behind a screen in a way they would never, ever be face to face. And a lot of the issues that we end up fighting about online, they're not simple, they're not straightforward. You can't stick them in a tweet. They're nuanced discussions that we need to be having with kindness, and you can stick whatever issue in there that you like, whatever it is, it always applies. But it is just, I always think, you know, if you wouldn't say that to somebody's face, don't say it online. It's just step back. Or a big thing is not assuming that people feel a certain way or think a certain way. You know, if you wouldn't do it face to face, if you're in a meeting with somebody and they said something that you weren't sure about, you'd ask a question, wouldn't you?
Yeah, absolutely. So it's asking the question, it's being kind, and thinking about, if you can't say something to someone's face, don't say it online. Thank you for that, Amy. Now I have a question from Jeanette Mortimer. I don't really understand this question. It's obviously an expert question. Hi, Jeanette. And she's saying, hi, do you have any really good cluster feeding resources?
Oh, gosh. I'd have to look that up for you. In terms of which way, in terms of actually supporting a mother, I'd have a look online, have a look at the Lecture League website, Kelly and Mom website, some really good websites for supporting babies there.
Okay. Thank you. Well, that's dealt with.
Off the top of my head, though.
Off the top of the head. Okay. And Lindsay Durant, hi Lindsay, says, can I ask Amy, which 2 pieces of research do you recommend signposting women to read that explain the importance of breastfeeding? It's still a difficult conversation. I wonder what you might suggest. Trying to gather as many tools as possible when time is limited, as it always is in practice. Absolutely, Lindsay. Thank you, and kind regards. And that's Lindsay. She's lecturer at Sheffield Hallam. So shout out for Sheffield Hallam.
Oh gosh, if you're actually wanting to refer people to researchers in research papers, I'd always refer them back to that Lancet series on breastfeeding that was out in 2016, which gives some really good research summaries around the importance and the issues around it. So I think the 2 things go hand in hand. We shouldn't just be telling people about the importance of breastfeeding, with also making sure that they understand some of the broader issues around it and where to get support.
Fabulous, thank you. And there's a comment from Sarah. Thank you, Sarah, who says about social media. Social media conflict is so tiring, but when you see the outpouring of support, research and knowledge, it makes it easier to stay on social media. Well, I guess that's the balance, isn't it?
It's about choosing who you listen to.
Yes, there might be some blocking. Okay, thank you, Sarah, for that. And then we've got another comment from Katie Polkefak, and I'm sure I pronounced that wrong, Katie, so apologies. And Amy Brown, thank you. Those who matter don't care, and those who care don't matter, or something like that.
I know what you're trying to say. Yeah.
I like it. I like it. That's a nice one. I mean, I like the sort of the looking after yourself. So in your book, have you got a little list of top tips?
Oh gosh, yes. I've got an entire chapter on ways to look after yourself that don't have to involve gin in a hot tub, but that was my favourite one, to be honest. It's really strategies around what you can do to help care for yourself. So it's about thinking about your mental health. It's about looking after yourself physically. It's about taking that time to let your system calm. Even talked about cold water swimming. Now, I am not a fan of cold water swimming. I'm not going there. I will run stupid distances, but I am not getting in cold water unless it is very hot. But there is actually a lot of research, and this seems to be you can go one of three ways when you're sort of in midlife, it seems, as a woman and a health professional. You start a PhD, you go cold water swimming, or you take up something like weightlifting or running very, very long distances. So you've got a choice. Okay,
choice of three. I wonder if our watchers and audience could come up with more than three.
It's the main three. That's my research hat on. But apparently there are a lot of benefits to swimming in cold water. But
no, maybe we'll skip that one. But I mean, it's quite interesting in a way, isn't it? Because it's it's the looking after yourself, and I think you're talking about the breastfeeding advisors, supporters, lactation care, but it's probably the advice they're giving to women and their families to look after themselves. They need to kind of physician heal thyself sort of thing, isn't it?
Basically, yes. So if we think about all the messages that we give frazzled new mothers and saying, you need to put yourself first. It's all right to put yourself first and to look after you too. And it's exactly the same for those, we need to take our own advice, and whatever that way may be. That, lots and lots of examples, from just sitting on a bench and looking at the sea through to, singing karaoke or something was one, but it was just about finding your thing and giving yourself permission to do it, and having that time to yourself, even with such a busy schedule. It is so important in thinking about your well-being, but also your ability to carry on with this long term, because we all think we won't break, but we will at some point.
Yeah, a few minutes sanity there. Thank you. And I've got Natalie Schenker. Hi, Natalie. And she says, how can those in leadership roles support teams to safeguard well-being? And what is your favourite gin at the moment?
Natalie. We can have more hot tub and gin days. We need to ensure that as mentors and line managers and managers, that those we are supporting have goals to look after themselves as well. So we set them targets, and Natalie will know, in research and academia, you should write this many research papers and do this many research grants. And so in lactation support, you should support this many families and do this. And also, this is your well-being goal. This is your gin in the hot tub. And my favourite gin is whichever one Natalie is buying me at the RCPCH conference that we're going to in a couple of weeks.
Oh, I see. I think I can see that generating a little bit. Now there's another question coming through, who's from Babs. Hi, Babs. who says the problem with breastfeeding with the woman is that it requires a lot of time to get it right, especially on the postnatal ward, which women aren't in there for very long. That's my own words. Midwives never seem to have time. How do we resolve the bureaucracy in hospital around breastfeeding?
I think we
Good question, Babs.
Not one that can be solved this evening, but I think it goes back to this bigger issue of pushing back against the system, and it's the same across healthcare. We need more investment in more posts, in more resources, and we need to care for and look after the midwives and the health professionals who are already in the system, because it's one thing putting more in, but we've got to focus back on supporting those who are in those roles.
And I guess the midwife, sometimes you have to drop the bits of paperwork you're doing to support the mum, because if you spend some invested time right at the beginning, for most in my experience, that does save a lot of time of when the woman's got problems feeding. But it's easiest to say when you're framed with people saying, oh, I need my discharge papers, oh, all of that. So difficult one. But that was a good question to kind of, we've got a space for another question if anyone's putting in a question, because I know. And forgive me, I should have said right at the beginning, I look over here because I'm very fortunate. I have two screens and the questions come through here and I can keep Amy on one screen, which is very nice. There's a few comments. So I think the enjoyment of your session, I know I could always listen to you for hours, Amy, because you come up with your ideas and your passion for what you're looking at is so attractive and interesting. Like when you talked about evidence and gathering evidence, that was a very good one. So if you haven't watched that audience, get that out of Matflix. I don't know if I think there might be another question coming, or maybe not. I think there is one being this is how I can tell something's being tippy tapped in. I'll see on my other Lynn's it's a comment from Lindsay Durant, and I'm giving the audience a health warning here. Lindsay says, have been wild water swimming in the last fortnight. Well, good on you and respect to you. I have several friends who do this, but I have to say it's not one of my things. The water has to be a bit warmer. And I know for Amy, that's probably so as well.
All in the south of France, I think.
Oh, yes.
There we go.
That's it. Okay. And I've got one last question now, which is a good question. And this is from Lisa Locke. Thank you, Lisa. And she says, have you had any success in raising this at higher government level?
Which bit? The well-being? Not yet. In terms of pushing for more investment into breastfeeding, we never give up. Slowly, just not giving up, and persistence. And if you look back over the last few weeks and months, you don't see a difference. But if I look back 5-10 years ago, when I started trying to do this, there's a huge difference in how it's being talked about. Even if a big change hasn't come, I really believe that if enough people keep pushing this, we will get that.
And we've got enough people, and many of them are with us tonight, who really believe in it and support women and babies and families. So that's the kind of take-home message really from Amy. So thank you so much, Amy, for being with us this evening and sharing your research. Now, go out there and check out on Amazon or Amy's own website, which is a fantastic resource, and you get lots of information from there. So thank you so much. You go wild swing if you wish as well after this. So I'm just going to highlight, just say a big thank you also to our audience. I'm highlighting also next week's Maternity and Midwifery Hour. What we're going to do is have highlights from the festival in Manchester. So look out for that. Same time, same place, 7 till 8 on the Wednesday evening. We've got the North Festival next week in Manchester, 21st of June, that's Tuesday. If you're coming, there's loads and loads of parking if you're coming by car. And if you want to drive, you share a car and share the driving, that'd be fantastic. It's a super program, and really good. It's going to be a really good day. And some of the exhibitors, and especially the charities, have got some really good little little surprises for everyone. So do make the effort to come live if you can. If you can't join us on live, we'd be very happy to see you. 29th of June. Now, this is, as I said earlier, this is obviously the season for student midwives, because we've got our Maternity and Midwifery Forum student celebration event, and we've got a whole afternoon of deliciousness for you. So have a look and book for that. For now, we've got some super speakers, and we're delighted Professor Mary Renfrew is with us as well. So do register for that. We've also got Wales and Southwest Festival on 13th of September. So do register for that as soon as you can. You know, if you can't make the event, you can always come online, but do try and make the event, because you get such a super buzz meeting other students, midwives, practitioners, lactation support workers, the whole gamut of people. So we'll look forward to seeing you, especially next week. And in the meantime, stay safe, stay well, look after yourselves, and we'll see you next week. So take care.